Now in the third section, we will talk about different diagnostic tests we can do for the presence of foreign body in the airway. So some tests that can be done is the view of the neck. What are the different tests we can do? We will talk about them later in the section for the examination of the foreign body in the neck. Very important. Then chest. If the foreign body moves down into the lungs, in the bronchi, then we look for the chest x-ray. And then we also can do the fluoroscopy and the CT of the chest. So diagnosis is detailed history is the first. Whenever we talk about the examination or diagnosis, the first most important thing is the history. Always ask the person that if it's a small child, ask the parents what they were playing with, what are the different things that are present in the area they were sitting or playing. So all these questions are important in the history to find out what it can be. Then history of foreign body ingestion, then physical examination of the neck and chest should also be done. Auscultation of the chest is also helpful to find out or to hear the voices or sounds. So physical examination of the neck and chest in general are helpful, or they should be done in the diagnosis. Then history of sudden onset of coughing. Ask them if the person coughed after the foreign body was aspirated, because sometimes after even the foreign body is expelled out or coughed out, usually the foreign body can cause some irritation in the throat, and person might still be feeling that they have a foreign body present, so even if it is expelled out. So coughing is important. Ask if they have a cough or not. Wheezing, if it was present or not. Diminished entry of air into the lungs on auscultation. So if on auscultation there is diminished air that is entering into the lungs. So all this is important to ask. Diagnosis, again, we have high index of suspicion should be raised if in children, if they have wheezing and they have stridor, cough or asthma, those with recurrent chest infections, treated with steroids and antibiotics. Radiology is very helpful. So usually always make sure after the initial examination, high index of suspicion is always in children, because they are the most likely affectees of the aspiration of the foreign body that can affect them. So children, high index of suspicion always if the children, they come with wheeze and stridor. And patient who have cough or asthma, those with recurrent chest infection and they treated with the antibiotic and steroids, always look for the foreign body or the condition with the help of the x-ray or the radiology. View of the neck, extended position of the neck shows the soft tissue. We look for in the postero anterior view, PA, lateral view of the neck. So all these are the different views in which the neck should be examined or x-ray should be done of the neck in the lateral view or of the neck, or in the PA view or postero-anterior view. PA view is especially helpful for looking the soft tissues of the neck. They show radio-opaque bodies and even radiolucent bodies in larynx and trachea. So radio-opaque bodies can be easily viewed, but even if the body is radiolucent, but it is present in the larynx and trachea, it can be visualized. Coin or a flat foreign body in the trachea. Edge on the in a PA view and flat on the lateral view. So if there is a coin or flat body like this, it can be seen on the edge in the PA view, or it can be seen flat in the lateral view. Next, X-ray chest, plain X-ray of the chest. You can see the foreign body. It's very easily identifiable, any foreign body that is present in the chest on the X-ray. So plain X-ray chest. In postero-anterior and lateral views, both PA view, postero-anterior, from back to front, and in the lateral views we can look for the foreign body in the chest. May show radio-opaque foreign body, radio-opaque that can be visible, which is visible through the X-rays, radio-opaque. Size, shape and location, we can exactly find out the size of the foreign body, the shape of the foreign body like a nail here, and the location of the foreign body by the X-ray. Plain X-ray is very helpful, should be the initial diagnostic procedure for diagnosing the foreign body. Right away do the plain X-ray of the neck, plain X-ray of the chest. It will give you the presence of the foreign body, where it is present in size and the location. Then lobar or segmental atelectasis we can also see in the X-ray. Unilateral hyperinflation of lobe or entire lung. So if there is a hyperinflation, if the lung is hyperinflated, we can also see unilateral hyperinflation of the lung or the lobe, we can see in the X-ray. And then we can see the mediastinal shift to opposite side if there is foreign body. So all these are very helpful steps which can help us to find out the foreign body in the chest, which is the plain X-ray. Next, the fluoroscopy or X-rays during inspiration and expiration can be done. Pneumomediastinum or pneumothorax, a presence of air in the chest or the mediastinum. Normal X-ray chest within 24 hours, partial obstruction, usually there are no signs. Pneumonitis, bronchiectasis. So we already mentioned that depending on the time for which the foreign body is present, if it is for the long time, later symptoms which are produced include pneumonitis, bronchiectasis. That can also be detected on the chest X-ray if they are present. X-ray of the chest, this is the chest X-ray. You can see the foreign body here. This is the arrow showing the foreign body present here. At the end of inspiration and expiration, you ask the patient to inhale deep and exhale, and the X-ray should be done at that point. So deep breathing and exhalation, both ways, take the X-ray to find out the foreign body. So at the end of inspiration, that, and exhalation, both at the end. Indirect evidence of radiolucent foreign body. If the foreign body is not radio opaque and we cannot see it, then what are some evidences indirect that can tell the foreign body is present but it is radiolucent foreign body? We have atelectasis present and there is obstructive emphysema present, and we already talked about the closed valve obstruction and check valve obstruction, and the it can cause the obstructive emphysema, later on atelectasis. All that can give the indirect evidence of radiolucent foreign body if there is atelectasis and obstructive emphysema. Then X-ray chest, PA chest view, postero-anterior chest view in expiration, during exhalation or expiration. Useful in bronchial foreign body. So bronchial foreign body PA view is helpful. Shows obstructive emphysema present and on site of foreign body with mediastinal shift to opposite side. So if the foreign body is in the bronchi, the PA view is effective. It can show the foreign body, it can show the presence of emphysema, shifting of the mediastinum to the opposite side. All these are present and we can see on the PA view of the chest. Again, here you can see a small block. Usually the children play with these things on the chest X-ray. Lateral decubitus film, lateral decubitus. In case of the children, hyperinflated lung is present. So hyperinflated lung, indicative of foreign body. Obstructive emphysema is the early sign. Atelectasis comes late. So initially obstructive emphysema, late we have atelectasis can develop. Other diagnostic techniques include the simple fluoroscopy, video fluoroscopy, evaluation during inspiration and expiration, and the CT of the chest. Computerized tomography of the chest is also performed. So that was all about the section 3. Thank you for watching sqadia.com.